If you have visited several different chiropractors, you probably noticed there were some differences. This is because chiropractors can study and learn many different techniques. In this video, we will share with you some of these different techniques that are available. It takes many years to learn how to apply these techniques well, which is why adjusting the spine is often considered an art form. Remember, a chiropractor's main focus is to improve spinal function, with the goal of improving overall function of the body. Improving spinal function can be done in many different ways. Regardless of what technique your chiropractor has specialized in, most will still check and adjust your spine where they find areas that are not moving properly, what they call a subluxated area of your spine. Where they choose to adjust you is not random or simply because you're in pain. They will be checking for how your segments move and feel. They might poke on a segment to see if it feels tender to you. They might also take into account your posture and how you move. The subluxated segment often doesn't move appropriately like the other segments do, and they're often tender to touch. You may not even have noticed that they were sore until your chiropractor poked on that part of your spine. Some chiropractors have specialized in other techniques also to determine how best to improve the function of your spine and body. So you may have some x-rays taken or various other scans. They may also test the strength of some of your muscles. Some chiropractors focus on the top of your neck only. Others will check how well your joints are functioning in your entire body, including your jaw, elbows, wrists, shoulders, hips, knees, ankles, and skull bones. Any one technique is not right or wrong, they are just different. So are chiropractors. So try to find a chiropractor that feels just right for you and your needs. As healthcare professionals, we want what is best for you and your health, and if that means you go and see another chiropractor, that is perfectly fine with us. When it comes to adjusting you, chiropractors again have many different options to choose from. They can adjust you with their hands and are usually trained in several different techniques so that they can do so effectively and safely. This is a skill that takes many years to master, which is why chiropractors study for 5 years or more at university level before they can be registered as a primary healthcare professional. Not only do they learn about anatomy and physiology and pathology, but they spend many years developing their skills to be able to gently adjust spinal segments to best serve you. Other ways they can adjust you is with an instrument. There are several different types of instruments available, such as the activator or the impulse. Some use these instruments and adjust you according to a set protocol that has been developed over many years. Others use these instruments as an alternative to adjusting you by hand. We know from research studies that the instrument-assisted adjustment is faster and even more gentle than adjusting by hand, and that they activate the same neural tissues as manual adjustments or hand adjustments. But we also know that manual adjustments, or adjustments done by hand, can be more effective at producing results for some people. However, we don't yet know enough about what is best for you at any particular time. One study showed that if you are in acute pain, that you get faster pain relief from adjustments done by hand as compared to adjustments done while following the activator protocol. So if you are in acute pain and want to get out of pain as fast as possible, you might want to get adjustments done by hand first. Another way that chiropractors can adjust is by using a special table where parts of the table can drop away slightly but suddenly. These special drop piece tables take advantage of the sudden drop where one part of your spine is firmly lying on the table while the vertebra above it is not supported on the table. This again can very gently help restore proper function to spinal segments. Again, there are some who have developed a whole adjusting protocol around the use of such special tables, while others use them simply as a means to get the right adjustment done for the person they are working with. There are still many, many more ways a chiropractor can adjust you. They can use special foam blocks to put under your pelvis. By using your body weight, this can ease or stretch your pelvic ligaments. There are also many techniques that focus on correcting poor posture or help improve non-spinal joints such as wrists and ankles and jaws and cranial bones. Your body is one big, complex, interconnected system. Some chiropractors will give you exercises and stretches to do at home. Some have specialized in nutrition or homeopathy and so much more. No one way is necessarily better than any other, but you may prefer one or more of these various techniques. We want you to get the most out of your chiropractic care by becoming aware of what's available. As parents, you would have discovered that your child occasionally wet their bed at night. But usually this is something they grow out of by the time they're 5 years old. But for some kids, this does not happen. For some children, this persists, and this is known as nocturnal enuresis. Not only is this frustrating for parents who have to change wet beds night after night, but it can also cause a host of additional problems for the suffering child. Some are devastated by their parents' disapproval, and some are teased by their siblings. Some of these children suffer greatly from low self-esteem that can have a major impact on their mental and emotional well-being. If this wasn't bad enough, many of these children struggle with their social life and miss out on sleepover parties and school camps to avoid other children finding out about their bedwetting problems. So why might chiropractic care help these children? Well, we know that gently adjusting the spine changes the way the brain perceives what's going on in the body. So improving spinal function with chiropractic care may help the brain and central nervous system to notice that the bladder is full and wake the child at night. So what does the research evidence say? Unfortunately, not a lot of research has been done yet in this area, but there are many individual cases published in the scientific literature suggesting that chiropractic care may help at least some children with their bedwetting. And in 1994, a group of researchers performed a clinical trial including 46 children who frequently wet the bed at night. They measured their bedwetting frequency for 2 weeks, and then they divided them into 2 groups. One group received 10 weeks of chiropractic care from final year chiropractic students, and the other group received a sham control intervention. They then measured their bedwetting frequency for another 2 weeks after the 10-week intervention period. So what happened after 10 weeks of chiropractic care? The researchers found that after 10 weeks, the children receiving chiropractic care had on average almost 2 more dry nights over a 2-week period. The kids who did not receive any chiropractic care had no change in the number of nights they wet the bed. This does not sound like much improvement. But when the researchers took a closer look at the results, they found that 25% of the kids who received chiropractic care actually had a 50% or more reduction in wet nights over the course of the trial. None of the control group had this type of improvement. This suggests that chiropractic care may well help at least some kids with their bedwetting, while for others it doesn't help so much. When appropriately applied, chiropractic care for children and infants is very safe and is rarely associated with adverse events. When they do occur, they invariably involve short periods of muscle soreness following an adjustment. Remember that the chiropractor isn't directly trying to treat the bedwetting. Instead, they're trying to improve spinal function with the aim of improving your child's brain's ability to process what's going on in their body. And for some kids, this seems to result in more dry nights and improved bladder control. So if you know of children suffering from bedwetting, share this information with their parents so they can try chiropractic care. We know from this study that at least some kids who wet the bed, chiropractic care really seems to help. So it's worth giving it a go, because it's not just about dry nights, but also about the child's mental and emotional and social well-being. Do you work out at the gym, pumping iron to get stronger? If you do, you may be fascinated to know about this recent study conducted in New Zealand. because the way your spine works actually influences how strong you are. In 2014, a group of researchers at the Centre for Chiropractic Research in Auckland, New Zealand, studied the effects of chiropractic care on a group of students. They measured how strong some of the lower leg muscles were in these students, and they also tested how strong the contraction messages from their brains were to their leg muscles before and after a single session of chiropractic care, as well as before and after a control session. They found that the students who received chiropractic care were actually able to produce 16% more force in their leg muscles after the chiropractor had gently checked and adjusted any dysfunctional spinal segments, or what chiropractors call vertebral subluxations. In contrast, the students in the control group that did not get chiropractic spinal adjustments were weaker after the control intervention. This is because their leg muscles were getting tired or fatigued from having to repeatedly contract during the testing session. This is really interesting because both groups of students had to repeatedly contract their leg muscles over and over again. But when the students received chiropractic adjustments, their leg muscles did not fatigue, and instead they were actually able to produce more force. This study shows clearly that spine and nervous system function actually impacts the way your brain is able to produce force, and can prevent your muscles from fatiguing during repeated strong muscle contractions. And it gets even more exciting, because it turns out that the New Zealand-based scientist had used the same methods and techniques as another group who looked at what changed within the brain and central nervous system when people either underwent 3 weeks of endurance training or 3 weeks of strength training. The New Zealand group's results after a single session of chiropractic care was just about identical to what this other group of researchers found in their subjects that had done 3 weeks of strength training. This suggests that your spine's function can have a profound effect on the way your brain can produce strength in your muscles. The same New Zealand group followed up this study in elite taekwondo athletes, and again showed that even in a group of elite, highly trained athletes, a single session of chiropractic care can improve their strength and prevent fatigue. A lot more research needs to be done because we do not yet know how much longer these strength changes last. But these studies highlight that spinal function has a far greater impact on our health and performance than we previously realized. The way your spine works actually changes the way your brain works. An amazing new study was conducted in 2015 in a hospital in Denmark. A group of people who had never had any chiropractic care before attended 2 sessions. One with real chiropractic care and one with sham chiropractic care. During both sessions, whole head brainwaves were recorded. The brainwave recordings, or electroencephalography, EEG for short, showed some very clear changes in the way the brain functions after the chiropractic session, and no changes happened after the sham session. The study showed a change in brain function of almost 20% on average after the chiropractic session. This study is really important because it's the 4th time this very same finding has been published in reputable research journals. And this study's data was collected and analysed by non-chiropractic scientists. This means there is no doubt that adjusting your spine changes the way your brain operates. Because the Danish scientists recorded the brain waves, or EEG, over the whole head from 64 individual electrodes, they could also work out exactly where the changes in function were happening after the chiropractic session. They were able to show that the changes were most likely taking place in an area of the brain called the prefrontal cortex. This part of your brain is a little bit like the conductor of the brain, making all the other parts of your brain cooperate together in perfect harmony. The prefrontal cortex is the area of the brain where your executive functions take place. This means it's very important for our everyday behavior. It's the part of the brain needed for us to be able to carry out all goal-directed tasks, decision-making, memory and attention, intelligence, processing of pain and emotional responses to it, autonomic function, movement control, eye movements, and spatial awareness. Therefore, demonstrating that chiropractic care changes function of the prefrontal cortex could explain many previous research results that have been documented with chiropractic care, such as improvements in sensorimotor function relevant to falls prevention in the elderly, or better joint position sense in both the upper limb and the lower limb. Also improved muscle strength in several lower limb muscles, better pelvic floor muscle control, and better ability to carry out mental rotations of objects in space. Being able to accurately perceive where you are and where your arms and legs are is very, very important. You need to know where you are to be able to move without having accidents. And it's also very important to be able to accurately perceive the world around you. This is a vital skill we need all day, every day. To recognize some objects, you may need to mentally rotate them. For example, to recognize the letter P versus the letter B, if they are not upright, you would need to mentally rotate them in your mind to figure out which letter it was. We all mentally rotate shapes and objects that we see, but we may not often think about that we do it, or how important it is for our daily life. Chiropractors have long observed a wide variety of changes in people under their care following adjustments. Along the wide spectrum of claims from those who are under care are those who say they feel better or are able to focus better, and those who notice improvements in movement and coordination. This study takes us a little further down the path of understanding why this could be. So have you seen your chiropractor lately? You may want to have your brain's conductor fine-tuned too. Some people are worried about seeing a chiropractor because they think that chiropractic adjustments might be harmful or dangerous. So let's look at the research literature on this topic to see what the science actually says. When we look at the literature relating to chiropractic care, we can see that it's remarkably safe, and it's effective, and it's associated with high levels of patient satisfaction. A number of studies have reported that chiropractic care is at least as effective as, if not more effective, than traditional medical management for patients with a variety of spine-related issues. Chiropractic care actually has an enviable safety record compared to most other healthcare interventions. However, virtually all forms of healthcare are associated with some risk, so let's look closer at this. With the sort of manual or hands-on procedures that chiropractors use in everyday practice, it's logical that there is at least some risk that on rare occasions some people may suffer from an adverse event after seeing their chiropractor. A number of researchers have reviewed all of the published literature relating to the safety of chiropractic care. According to these reviews, serious adverse events are very rare, and most of the time the scientists weren't sure if the chiropractic care actually caused the event or not. Because serious adverse events are so few following chiropractic care, it's virtually impossible for researchers to accurately estimate how often they actually occur. So there are only rough estimates for serious adverse events, and these estimates range from 1 in 20,000 to 1 in several million chiropractic visits. To compare this with other types of medical care, we know, for example, that as many as 1 in 3 adverse events can occur if someone goes to hospital. What is more common with chiropractic care is that some people can feel a bit stiff and sore after they've been adjusted, but this usually goes away by itself. So according to the best systematic reviews of all the scientific literature on this topic, we know that being seriously hurt from seeing your chiropractor is extremely rare. In fact, the statistics tell us that you are about 10 times more likely to be seriously injured driving to and from your chiropractor's office than you are from being seriously injured while seeing your chiropractor. Despite all of these studies showing how rare adverse events are with chiropractic care, there are still some people who are worried a chiropractic adjustment could cause a stroke. This has also been studied very carefully. In 2 separate studies, researchers looked at extremely large patient databases from insurance plans in Canada and America and compared over 2,600 patients who had actually suffered from a stroke involving the arteries in their neck, and they compared them to people who hadn't had a stroke. They looked to see whether the people who had suffered a stroke were more likely to have seen a chiropractor or a medical doctor before suffering from the stroke. What they found was that people who had suffered from one of these strokes were no more likely to have seen a chiropractor than a medical doctor before the stroke occurred. In some groups, they were actually more likely to have visited a medical doctor than a chiropractor before the stroke. So what does this mean? The studies suggest that patients who are suffering from a stroke after seeing a chiropractor are probably going to see the chiropractor because they had neck pain or headaches that had been caused by the early stages of the blood vessel damage that ultimately caused the stroke. So they were having a stroke in progress before they went to see the chiropractor. It also means that there is no greater risk of suffering from a stroke if you choose to visit a chiropractor compared to the risks of visiting a medical doctor. So if you or someone you know is worried about seeing a chiropractor, you can rest assured that chiropractic care is associated with very low risk of causing serious harm. The risks are so rare that they cannot be accurately estimated. And of the risk estimates that have been made, most suggest that serious adverse events associated with chiropractic care happens perhaps every several 100,000 visits. Like any healthcare intervention, some adverse events do of course occur with chiropractic care, and these adverse events are generally minor and go away by themselves, and don't take away from the high levels of patient satisfaction associated with chiropractic care. So despite what some people think, chiropractic has an enviable safety record, and you can rest assured that if you go see your chiropractor, you're in safe hands.